On the evening of Friday, October 28th, 2022, Steve was enjoying a pizza dinner with his daughter when he experienced a sinkhole episode. 911 was called by concerned witness, and Montgomery County Fire and Rescue, paramedic engine 731 and ambulance 732 arrived on scene. The crews were greeted by Mr. Henske, who is now awake and alert. He stated to the crews that he was feeling better and did not needed to be fussed over. Mr. Henske allowed the crews to perform an assessment, including his vital signs, which were all within normal limits. Mr. Henske did not want to be transported to the hospital and just wanted to return to his home. As the crews were obtaining Mr. Henske's story, he mentioned that this was the second time in less than 24 hours that he had experienced a syncopal episode. The crew spoke to Mr. Henske about the potential risk of not seeking further treatment and evaluation, and he finally consented to be transported if he could be seen at Walter Reed National Military Medical Center. The crew happily agreed to take him as requested, and they assisted Mr. Henske to the cot and packaged him for transport. En route to Walter Reed, Mr. Henske was placed on the cardiac monitor and found to have a normal sinus rhythm with occasional PVCs. Vascular access was obtained, and Mr. Henske's condition and vitals were monitored and remained stable during transport. Upon arrival to Walter Reed, patient care was turned over to the hospital staff. Mr. Henske presented as asymptomatic at this time, but based on the multiple sinkhole episodes and other medical history, it was decided that they would conduct a cardiac workup. As Mr. Henske was being evaluated, he suddenly went unresponsive and converted into sustained VTAC rhythm. The hospital staff quickly responded and administered amiodarone, which converted the rhythm back to normal sinus rhythm. Based on this episode and the previous two sinkhole episodes, it was decided that Mr. Henske should receive an automatic implantable cardiac defibrillator. A few hours later, Mr. Henske underwent a successful surgery and quickly recovered. Mr. Henske was quickly able to be discharged to his home, to his grateful family shortly thereafter. Mr. Henske was able, and his family would like to thank the fire and rescue crews that responded to the scene that October evening. If the crews had allowed him to return home instead of being transported to the hospital like he wanted, he believes that he would not have the same positive outcome. Mr. Henske and his family believe that the crews were there for a reason and truly saved his life.
This goes to show you, I was an EMT back in Staten Island, New York, back in my 30s when I was a hospital administrator. So I subsequently came up to this area, became the faculty advisor for the Georgetown Emergency Medical Services at the university, usually referred to as GERMS, which is kind of a cute term, but you trained 110 college kids on how to respond to an event. I found it interesting, and my wife constantly reminds me of this, sometimes healthcare professionals, and I'm a hospital administrator by training, are their worst patients because they sort of want to deny that they're having the same problems. So, being retired Navy, we have an opportunity to give a little thanks to the people who picked you up and kept you alive. Yesterday was my 76th birthday, and as I was contemplating the last year, I realized just how important our team is. It reminds me of how strength we have in our community. So one of the military traditions is to give the providers what we call a challenge coin. And it's a remembrance of something that was done high quality and great appreciation. So I have some with me now. I wasn't sure how many people were on the other trucks because when I went down, I was a little bit out of it. So I'll have a couple of coins here I'd like to present to these two gentlemen, and then I'll get the rest later.